You're watching continuing coverage of the World Healthcare Congress 2012. I'm Mabel Zhang. Thanks for being here. Well, will reform-driven innovations continue if the Supreme Court strikes down the law in June? We have Jeff Welch here with us today. And Jeff, I really wanted to ask you, what is your organization doing in terms of being on hold, since we know that there will be key decisions coming down in June?
Well, obviously we're well aware of the June decision, but it's not putting us on hold. A lot of the initiatives that we're doing and that's taking place today are initiatives that are going to be market driven anyway. Some of the other parts of this and the decisions that are taking place in June will also be associated with the kind of the subsidy driven side of the House and other pieces of that legislation. But in general, we're not on hold. We're still proceeding forward with technology innovation, product innovation. We're still having demands from our clients to meet those needs and wants that they have.
Is there any concern that if decisions about which part of the law will be struck down might make some of the work you've done, canceled out because it might not be compliance with what will be the law in the end?
Well, to date, Healthcare Service Corporation has invested about 350,000 hours into this legislation, and we're going to continue to move forward as if it's still in place, because a lot of the things won't change regardless, because what will happen is you've got the federal piece of this, but then we have to also work on a state level. And at HCSC, we have 4 states that we work within: Illinois, Texas, Oklahoma, New Mexico, which have very active Department of Insurances that we also are dealing with as we move into this legislation session too.
You had mentioned that customers are demanding that this really go forward. What are you placing your priorities on then?
Well, there's the public exchange initiatives that are taking place, which public exchanges are designed for the uninsured and underinsured and the subsidy-driven piece of the market at individual. But our national accounts and large group clients are demanding other innovative solutions from a technology platform. Private exchanges are a very important piece to what we're doing, because private exchanges are simply a distribution technology platform that's using defined contributions to allow employees to make selections and choices based on economics. And a defined contribution is simply a dollar amount, a fixed dollar amount an employer gives the employees, and then we provide them an experience and a menu to go through an enrollment process and select plans that best fit them.
There is an atmosphere of much more cooperation, it seems like. Is it your feeling that people and organizations that you wouldn't have spoken with before are now coming to the table faster?
It is. It's accelerating a lot of collaboration. Our clients are asking for this also because they're looking for other innovative ways to bend the cost curve. We're all working on medical management, delivery system changes, cost reductions, and bringing in the private exchange as a distribution platform, giving employees more choice, but yet an economic incentive to work with us is very important to the system.
And what about cost containment? Are you finding some of that is happening as well this in the past few months, in fact?
Absolutely. A lot of the initiatives that are taking place are centered on HMO-driven cost containment, narrow networks, where you're taking your large PPO networks and creating smaller networks within there for employees to choose from with different price points so they can make it more affordable.
Okay, great. Jeff Welch, thank you very much for being here today.
Thank you.
I'm Mabel Zhang. Thanks for watching.